Hi, welcome to the Healing Medicine Show. So, we normally produce this show on Thursdays at 1 p.m. Central Time as part of the Healing Medicine newsletter on LinkedIn Live. Today, we're having a very special guest, Yewande Adekoya. Thank you so much for joining us here on the Healing Medicine Show.
Thank you very much, Blair. I'm so happy to be here.
So this is a special episode for World Pharmacist Day, and the vision for this show has always been to provide a platform for health and healing professionals to be able to grow and what does it mean to be a healer? So the goal of this show and this conversation is to provide people with resources and inspiration for both personal and professional development practices, especially those rooted in holistic health.
Yeah.
And, we believe that this change, the change we want to see in healthcare, it starts with the individual.
Yes.
So you said something before we started talking about you cannot give what you don't have. So
no, you can't.
I just want to start off this interview by asking you, you're a management consultant for pharmacy owners, and you also run a community that help mothers connect with their inner power.
Yeah.
First, I just want to start off this conversation with, what does healing medicine mean to you?
Okay, thank you, Blair. Healing medicine is a very interesting thing. It's to me, healing medicine is using the power of nature, using the power of the universe, right, to create balance in your spirit, soul, and body, right? It's using what has been created, what has been, right, to help revitalize your soul, revitalize your body, because I believe that our body is a self-healing system. That's why you see someone who has a wound on their body, and the next day, the wound closes up if there is no infection. It heals by itself. You see someone who is having a headache now, a serious headache, and can't even open his or her eyes, sleep for, have a good sleep for 6 to 8 hours, wake up, and the headache is gone, right? That's a miracle. So healing is something that it's not just the absence of illnesses, but it is we getting to that point where our body is stable, is balanced, is rejuvenated, revitalized to heal itself, to fight diseases, to help us to triumph over any health condition, any ailment or diseases that comes across our body. And not just our body, our minds, because our minds are very powerful. Our minds also control our body. Our spirit controls our mind. So we are spirit beings who have bodies and a mind, right? So it's very important that we are in touch with ourselves. Being present, is very important also in health. You cannot live in the state of balance when your mind is filled with anxiety, is filled with so much noises. So healing is a progressive journey of attaining balance every day of our lives using the power of nature.
I love that. And I agree with you. I really believe in this divine intelligence in the body that
yes.
if we're able to remove that offending thought or emotion, or really to be able to understand how our decisions are impacting our reality.
Exactly.
That it makes sense. And because it's World Pharmacist Day, I think in modern medicine, we have this idea of the body kind of controlling everything else. And we have this approach that's very mechanical.
Yeah, very mechanical.
There's this symptom, so we give this medication. But what I hear you saying is that there's this other opportunity in spirituality, in mindset work, and emotional intelligence that also contributes to health.
Yes, very true. One of the things I've discovered in my practice as a pharmacist, in the community setting, helping patients with their health, is that people need more than medicines, right? In fact, before medicines, they actually need faith. They need belief. They need to believe that they are going to be fine. They need to believe that the medicines will work. They need to believe that you have solutions for them. They need to see you. They do not see you, right, as just a medical practitioner. They see you as their healer. They see you as their healing being. So you're like a god, right, to these people. So you need to embody that thing. They need faith. They need hope. You know, I call myself an ambassador of hope, right? Not just a medical practitioner. So I've had to deal with patients that were suffering from serious ailments and chronic condition. Some were so devastated, and I just had to first speak to their souls, speak to their minds, to calm them down, to take away fear, to take away anxiety. Then I presented to them, you know, something which I usually call, my medicines are usually called instruments of hope. So I'll tell them that you need to believe. Then I give them medicine and I say, these are instruments of hope. I am hopeful that these instruments will work through you, will work on your body, will empower your body to beat whatever disease or ailment that you're struggling with. So it's just beyond you just giving them medicine. Oh, you have headache. Okay, just use acetaminophen and you'll be fine. Oh, you have body pain, use ibuprofen. Oh, let's check some other things. Oh, you have cancer. You have 6 months to live, right? It's beyond that. Our internal system controls our outer system. So you need to empower the internal system. That would empower also the body, which is the external system. So that way we start seeing ourselves as, you know, the powerful beings that we are, who have been created to heal ourselves. We have been created to heal ourselves, right? All I just do as a health practitioner is to show you how. And that's how I see myself, and that's how I work.
That's a very empowering message for patients, to say that you are a healer as well. Like I'm trained, I have the degree, you know, I have the credentials, I can be the guide, I can give you the instruments, but it's your belief, it's your intention for healing and where you want to get in your own healthcare journey. To see yourself as a healer, and what an empowering message that would be to our patients to say, you know, you can beat this, you can heal this. And oftentimes it's very associated with healthy habits and lifestyle change, and everyone knows, you know, we should exercise more and we should eat better. That's no secret.
That's no secret.
But they're not getting the support through that. They're getting the information, but not the transformation. So in your opinion, you know, what kind of healing needs to take place in healthcare? And I would love to hear a little bit more about your own personal healing journey.
Okay. All right. So I honestly believe that healthcare professionals need to preach these empowering messages, to say that you are the custodian of health. Everyone is a custodian of health, right? You just need to empower your ability to heal itself, your body's ability, your soul's ability to heal itself. And that is why you need all this information. That is why you need to practice these healthy routines. These healthy routines are not just routines so just for you to be healthy. It is basically you empowering your body, empowering your mind with meditation, affirmation, right? Yoga, mindfulness, connecting with, you know, your loved ones is very important for your mind, to empower your mind, to take charge of your life, to take charge of your well-being, right? It's so important for you to drink water, to hydrate, to exercise, to move your body. Your body is made for movement. So we need to let our patients, healthcare professionals need to start embracing the need for patients to see that their bodies, their soul are made for this. This is how we were made, right? Our society, technology, transformation, everything, growth is what is bringing us different things. But this is how your body is meant to be. You were created to be healthy. You were created to live healthy. If you do anything outside of that, you would not thrive, right? In your soul and in your body. So that is the healing that needs to go. The healing that needs to go into the healthcare profession is the healing, is the radical transformation of the mind for healthcare professionals to stop treating just diseases, but start treating the human body, the human soul. Stop treating diseases. Treat the person, so that the person can cooperate with you to attack the disease, to attack the ailment, to attack the infection. So that mindset is one thing that needs to go into the healthcare profession to help change the mindset of healthcare professionals. Let us start embracing ourselves as guide to help these people to empower their lives. We are guides. They are the heroes. They are the ones with the bodies. So even that way, we will be more invested. We will be more connected with them. Then these patients will be more empowered to do what they are supposed to do, right? Because they know that they are the ones who are the custodians of good health, of the health that they so desire in their body. Their body is made for health. So all they just need to do is to activate the healing that their body possesses. Okay, so my own personal journey started about 5 years ago after I had my son. I was just a passionate, healthcare professional. Let me just help people get better and all. Then one of those days I had a sharp pain at my back, and I think I did a scan and it was kidney, urinary tract infection, knowing that, I have some form of infection with my kidney. And I had my son, and I'm like, I have to be healthy. I have to be alive for this child. What are the things I need to do? Then coincidentally, I went to work the next day, and I was prescribing a natural medicine for one of my patients. And the patient said, "Oh, do you use it? What natural medicine do you use? What do you do for your health?" It was so interesting, but it was compelling. It was a compelling question. And I didn't have anything to say because as of that time, I had nothing that was doing as regards to my health. So that day, I went back home and I knew I had to do something. I do not just want to tell people what to do, but I want to live by example. Mm-hmm. And most importantly, I want to be alive. I want to be healthy. I want to do everything that is within my power to be okay for my child, knowing fully well that if I'm not there for him, nobody else will, right? So that was how my healing started, my healing journey started. And I started taking my health seriously. I started watching what I was eating. Prior to that time, I could eat anything without caution. So I started putting, checks to what I eat. I started setting an alarm to drink water. I started taking some natural herbal tea, that would improve my antioxidant level and balance my hormone. I also suffered from hormonal imbalance. So I knew that I needed to really, improve how I lived. So I started my search on natural healing, holistic therapy, wellness. That was when I knew that wellness is not just about the body. Wellness is a total well-being, is attaining balance in your life as a human being, right? Your spirit, soul, body, your social wellness, there is emotional wellness, mental wellness, physical wellness, sexual wellness, right? Maternal wellness, right? And, being a mom, knowing the stress that I go through as a single mom to raise my son, provide for my son, love my son, be there, and also still achieve a lot of things. I knew that I needed to help mothers to not just be mothers, but be women, to be powerful women, to be powerful persons, powerful professionals who are mothers. Most of the time when we are mothers, we forget every other thing about ourselves and we just want to be mothers because it's overwhelming being mothers. So now my goal is to also bring wellness into motherhood, to say you are not just a mother, right? You are a woman who is a mother. You are a woman who is a beautiful woman, right? You are a woman who is powerful. You are a woman who is pursuing this. We are a woman who is pursuing that. So motherhood is an aspect of your life, albeit a very big and central aspect of your life, right? But you must not deny yourself the essence of being, right? Because without BAME, you cannot be a fantastic mother. You cannot be an highly effective mother for your children. So that has been the summary of my healing journey, of how I've evolved over the years, being a mom, being a healthcare practitioner, now graduating into management and consulting. I still do I still do wellness and community pharmacy practice for some selected patients, that come to me. But in all, I am attaining balance in my emotions, balance in my soul, balance in my body. Right? It's been a journey. Sometimes I'm offside, stress is kicking me out and, kicking my ass and all. But, because I have an anchor, my anchor is balance. My anchor is to get to that point where I am in touch with my spirit and my soul. I am present in the moment. I am enjoying life. I am watching my life. I am intentional about everything that I am as a person, as a mom, as a healthcare practitioner, as a businesswoman, as a family member to many people, as a friend, lover, everything. I am very intentional about everything that I am and everything that is in my care. And that to me is healing. That to me is health. So everything about me receives the power of healing, because I see myself not just as a healer, not just as a healthcare professional, but as a custodian also of healing, as a custodian of health.
I love so much about what you said. I think going back to this, like attaining balance, to me, that means what I hear you saying, I resonate with, as a mom, struggling with staying present, because I'm also a business owner and a friend and a wife and so many other things. For me, my my whole professional career has always been about achieving and pushing forward. And so I've always had a very future-based mentality, which is good. It's great to have goals. It's great to be focused on your goals. But I also realized that it did keep me from being present. When I was with my kids, I was thinking about my business. When I was working on my business, I was thinking about my kids. Some people say that they have trouble with ruminating thoughts that are focused on the past. I wish I would have done something differently. I wish I would have said this differently. Having anxiety and things like that coming up about not feeling enough, not feeling confident with, creating those boundaries to say, what, I don't have the energy to be all things to all people. Yeah. But here's what I do have the energy for. Here's what I'm showing up for. It's for myself, and it's for, my kids and my family. And I saw, it was like a meme or something the other day that said, we're willing to die for our kids, but are we willing to get healthy, and live for our kids? And that really resonated with me, because my kids have been such a big part of my health journey, to just recognize, like, what are the decisions I might be making differently, than I would have thought of before. So I was trained as a pharmacist in a very traditional medical model, but personally, I was really focused more on nutrition and holistic health and this mind, body, spirit medicine. And I would connect with other pharmacists, that one of them in particular, he was doing a diabetes management program. And before they started each program, he would gather the participants. They would, sit or stand, and they would actually practice yoga together. And, just a 5-minute warm up chair yoga, but you're beginning to like plant these seeds in our patients' minds of, you can get to where you want to be. And let's encourage our patients to set some health goals. Maybe your goal is not to run a marathon, but maybe it's to be able to walk to the end of your neighborhood and back. Like, asking what is their health goals? What are they wanting? Because, getting your A1C under 7 Like, is that, is that really important to the patient? Maybe it is, maybe it isn't. It's important to us as healthcare professionals and the insurance companies as we're looking at the metrics. Absolutely, it's important. But what's really important to the patient? It's more quality time with their family. It's a less morbidity and mortality associated with chronic conditions. And now we're seeing, in the United States, about 50% of our drug spend is going to specialty medicines. Yeah. And a lot of times it's, medications for autoimmune conditions and things like that, that I think as we are getting a better understanding of this mind, body, spirit connection, we'll be able to really pinpoint, okay, the anxiety or the depression is stemming from this emotion or this situation or this relationship that needs healing.
Very true. I agree with you, Blair, that the more we understand that we have different aspects of our lives that is connected to our health, our physical feelings, our emotional feelings. Sometimes you feel so tired and anxious about something, and all you need to do is to connect with yourself, to ask, why exactly am I feeling this way? Why am I just tired? Why am I coughing, right? Why do I have a cough? What did I eat? Where did I go? So that's another level of bringing mindfulness into how you feel. Just say, oh, I have a cough. It must be a viral infection, or it must be a bacterial infection. Okay, why should you have a bacterial infection? Okay, why will you be infected bacterially with a bacterial infection? And, it's for it to thrive in your body without your, normal bacteria, the good bacteria in you fighting it. So you must look at that so that you don't continuously become a victim of falling ill. Asking the question, why exactly? What could lead to this? Could it be a diet I'm eating? Could it be, the lifestyle that I'm living? Could it be something that triggered me? 2 days ago, I just started waking up with anxiety in my soul, serious anxiety. And this morning, I had to ask myself, why are you anxious? You have to find out why you are anxious. And quite frankly, I took it upon myself to be sensitive to everything happening around me today. So today, this afternoon, I was able to engage in some conversation with somebody, and it honestly opened my eyes to why I was feeling anxious. And I got my answers, and I became better and knowing where the anxiety is coming from or what's coming from and what to do about it going forward. It's not like I still do not feel the palpitations, but it is reduced. And when it comes, to me, is now a signal to do something, but not just to be helpless. So, which means that I could probably just think, oh, I'm having anxiety, so I must need an anxiolytic. Right, that's the way we do in the medical profession. Oh, you're constantly having anxiety, but we need to, a patient sometimes might not even be able to tell you as a medical professional why they have the anxiety. They just have the symptoms of anxiety, the palpitations, the sweating, the cold hands, the sleeplessness, the tiredness when they wake up. But you just say, oh, you're having anxiety, and the next thing you're giving them the benzodiazepines and all the anxiolytics that you can't lay your hands upon. But there is actually something triggering it. There's a triggering factor. So that's why therapy is another powerful healing method. I always recommend for my patients that have serious ailment, chronic ailments, to also go for therapy. Sometimes you never can tell. Recently, I had a patient that had, serious high blood pressure, and my usual self would ask questions, and I had to ask him, what exactly is bothering you? And he eventually told me, oh, it's my financial life, right? I'm worried. Yeah. I'm worried. And guess what I did? I introduced him to meditation and gratitude and affirmations, meditation, abundance meditation. And guess what? His blood pressure is much more better than it was before, with little or no medication. right? But I could have just been giving him antihypertensives and, just treating the symptoms, crashing the numbers, but not actually healing him. So the blood pressure still is there, is managing it. Sometimes he uses the medications. Sometimes, we have to pipe down. I work with his doctor to pipe down the milligram, the strength, and the frequency of dosage. But he's much better. He feels much better. He sleeps better, right? He doesn't wake up with the palpitations. He doesn't wake up with the headache. He sleeps better now. He doesn't wake up incessantly during the night. So I'm so grateful that I'm able to help him identify what exactly caused what happened. So it's very important that we start reaching out to patients, asking them questions, carry them along, asking them what exactly is important to you, what exactly is wrong with you, why are you feeling, when did you start feeling this way, what happened? Not assume that everything has to be health challenge, the physical challenge. It could be mental, it could be a loss of a loved one, it could be a loss of a job, it could be a pain. Sometimes people have physical pain triggering their blood pressure to rise up, right? So it's very important that we do not alienate the different aspects of our life from our healing journey.
I love that. And, even going back to seeing how sometimes our emotions can, if we're stressed about finances, we might carry that stress in our shoulders, which ends up causing back pain. So then we have to, are we treating the back pain? Are we treating the anxiety? Are we treating, it just kind of has a snowball effect. For me, I think during the pandemic was really when I started really looking at what are those self-care health practices that can build natural immunity. Because so many people were asking me, should I take zinc? Should I take vitamin D? Should I do all this? And as part of a healthy diet, we definitely should be doing that the whole time. But also, how much time are you spending in rest? And we're so busy going, doing, and oftentimes it's for others. It's for, getting our kids to ball practice, or it's volunteering, or it's taking care of aging parents. I mean, a lot of women are kind of in this sandwich generation where we may be caring for kids and our own parents at the same time.
Yeah.
I see women as making a lot of or at least being a part of a lot of the healthcare decisions for not only for themselves, but also for their family members, because they are caregivers. So I want to hear a little bit about your community too. In closing, how do you help women? How do you help support those moms to not feel guilty about taking that time to cultivate their own self-care practices?
Okay, so I think it's me coming through what they love their family. They want to be there for them. When you ask an average African mother, Nigerian mother, what are the things important to you? The top of the list is my children, my husband or my partner, my parents, my siblings. So I'm always like, but how are those people right now? How do you communicate to them? How do you give yourself to them? Oh, how do you feel helping your loved ones right now? And they say, I feel tired. Some people start feeling resentful, right? I'm giving too much. I'm not receiving anything. They start feeling resent towards their husbands, even sometimes towards the children. Like they're just stressed because, they are not sleeping, and it's reducing their dopamine, it's reducing their endorphins, their oxytocin, right? So it's making them lonely, even when they are surrounded by people.
That resonates.
You understand? So I'll tell them this. I say, you know what? Even the people that you're living for, the people that you love, right? They're not getting the best of you. Why? Because you are not in your best shape. You are not in the best form. You are not in the best frame of mind. Why? Because you keep giving without giving yourself. And the only way you can keep giving is when you have You cannot give from an empty cup. So this truth is what I use to communicate with women. Now imagine yourself, what exactly would you love right now if you didn't have a child or a family that you are growing? And they start with, I would love to travel. I would love to look like this. I would love to do this to myself, for myself, who it will make me happy. And I ask them, why are you not doing it? And they start the excuses. Do you feel resentment not doing these things? Oh, yes, I'm not happy that I'm not. So why don't you start with the little you have right now, the little time? Oh, you cannot travel out of the country now. Well, can you just take one day off, probably in an hotel or even in a friend's house if you cannot afford an hotel, right? Just that getaway. You might not, okay, you cannot take the whole day off. Can you take some few hours off when your children are probably in school? Or, you can call in, you can tell your partner to do something like that, to stay in for you. Can you try to sleep earlier on some certain days of the week? Can you try to, in the bathroom, rather than rush in and rush out, can you try to scrub your skin? Can you try to breathe in when you wake up 10 times, and 10 times before you sleep? Can you try to set an alarm on your phone to drink water and to breathe? Start thinking of yourself as that instrument that needs to be taken care of so that she can have the power to take care of other things and other people that she loves. So that mindset orientation that we are doing and we still continue to push is what I've been able to help many women I've worked with personally, one-on-one, and the women I've trained. I recently this year, I engaged one of the women that was, in my training, and just telling me how she started herself. Every month she goes to the spa, she likes fine dining. She goes out to a restaurant with her family. And I had to start teaching her financial management to say, okay, now you're loving yourself. It's time to manage your finances. So that is my joy, seeing the people that have passed through my teachings, maybe read my book, or read my posts or my my articles on motherhood, on self-care, wellness journey, healing journey, and they're taking it upon themselves to start practicing these things in their own little way.
I love that, and I can just feel that energy from you of encouraging women to take that time for themselves really intentionally and being very respectful about their own time and asking for that time so that we don't get resentful, so that we have time to refill our cups. And I ask my clients, like, what do you do for fun? And if that question is really hard to answer, it may be a opportunity to get back to, what did you enjoy doing as a little girl or even a little boy? It's music or dancing or painting. It doesn't have to be a bath or a spa or yoga or meditation. It can be, singing. Yes. Just being in connection with something that fills your heart. And I think that's what we need more of in the healthcare profession. So Yewande, I am so glad that you joined us. It's wonderful to hear other pharmacists that are interested and like-minded about the integration of mind, body, and spirit medicine, so that we can help get to true healing. I feel like that should always be our goal, is true healing. And that's why we called this the Healing Medicine Show, because it's about, if that's our goal, if that's the goalpost that we're going towards, what small steps could we take to change that? So I want to thank you for your advocacy for women and for mothers in particular. And I want to thank you so much for joining us here on the Healing Medicine Show.
My pleasure. Thank you very much for having me.
Well, thank you. And if you enjoyed this show, please share it with a colleague. You can send them the link to subscribe to this newsletter. I'm going to post it in the comments. And if you're interested in learning more about becoming a health and healing consultant, really stepping into your healer identity, I'd love to talk with you. We're putting group programs together for our 10 weeks to 10K course, which is an opportunity for consultants in healthcare to create packages that can work with patients in longer term programs to get to that true healing, to get to the results that they're after. So thank you so much for joining us, and I hope you tune in again for the next episode of the Healing